on the phone with us. Co-Medical Director of Infection at Wyoming Medical Center, Dr. Mark Dowel. Good morning, sir. Thanks for joining us.
Good morning. Thanks for having me.
As you look at the numbers across the state of Wyoming, just to start off the conversation here, have we improved? Have we flattened the curve? Are we on the downswing like we all want to hear you say?
We have flattened, and there are some hot spots, as you can follow, in Fremont County and in Laramie County. But here in Natrona County, we've been lucky. I think we've done a great job as a county, been aggressive, and we have flattened completely here, which is great.
That is good news, but I understand you have a few cases at the hospital currently, don't you?
We have all through. We're not seeing
a
huge, all since it started, but we haven't seen a huge uptick at all. So we're good right now.
And, Doctor, as the county health officer, how's our capacity to test for the virus here and to treat people at medical facilities like Wyoming Medical Center?
Well, we've got great ability to treat people. So I want the public to know we're in good shape there. We've got all our systems in place. Testing, you hear this nationally, we don't have enough. The more testing we have, the more ability we have to tell how many people have had it in our area or have it with very few symptoms. So that is going to be the key between now and next winter, because as I've talked about before, when all the other viruses come in and when the kids go back to school, this virus is still going to be in the area, in Wyoming, at very small amounts. It may flare, and if we can test, then we can catch things early, we can isolate people if we need to, and we keep going on with life. That's the goal anyway.
So you talked about the curve here in Natrona County and in the state flattening. How do you feel the public and governments and healthcare providers have handled this? I mean, are there any actions that you think we should be taking and we haven't yet? Or are we in a place where if we are consistent with what we've been doing, we're going to be able to ease some of those restrictions and public health measures?
We're going to be easing things following what the governor has been talking about within the next week. We're going to be easing things up. You've heard about gyms and salons.
Mm-hmm.
We're going to be easing businesses open. We're going to work on the restaurants to try to help them. We understand. I'm a small business owner, so I know what this is doing to everyone. But we have to do it gradually. So we're setting up systems, and I ask our businesses, follow what we need you to do with the social distancing, the cleaning of equipment, like in a gym, distancing in restaurants, those kind of things. We should stay healthier that way, but don't cut corners. Like, I still want the public to put a face covering on in grocery stores because that's where our older people go. They're at the highest risk. It's a small price to pay, but those are the kind of things we still need to be doing. So we keep getting better. We keep opening up more over the summer, and everybody has a good summer.
Well, Dr. Dowell, you, of course, being in the industry you're in, have to deal with this every single day. Everywhere you go, you're making sure to wipe things down. Everything was clean after the last patient. But let's take a look at a business that has never had to deal with that. In fact, several businesses, you can probably think off the top of your head, are just naturally, for lack of a better word, dirty businesses. And they've never had the training that you've had. Where can they get that to learn a new way of doing business? Where do they go for information and guidance?
Public health.
Okay.
County health and the emergency operations center that we still have actively going on here. And, most of it is common sense, just having face coverings for your employees where it's indicated and having the basic materials to wipe stuff down and to spray it down with alcohol prep, that kind of thing. It's out there. Our county health is really available to guide. We're going to be doing that with restaurants because our goal is to get the restaurants open, but people have to realize when they go into a restaurant, they're going to be spread out, and they're going to have to follow those rules. At our gyms, we're going to have them actually screening people to make sure they're not sick, to make sure that they only go to one machine, this kind of thing. So we've got systems in place, and we'll work with industry to make sure they understand what to do.
Now, Doctor, a moment ago you spoke about later this fall and this winter as students return to school, the potential for a flare-up again of the virus. Can you expand on that a little bit, some of the things that might lead to a flare-up or some steps we could take or continue taking to avoid that?
Well, what I think will happen is, unfortunately, when people go back inside for the late fall and winter, virus can easily spread. And the concern across the country are the people that don't know they have it, that spread it easily. And you've seen how rapidly it can spread within some of the nursing homes and meatpacking plants in the country. So there will be multiple viruses around when the winter comes, and our job is to try to figure out, is COVID there or not? And if we find it, act quickly, but we'll have more testing by then. So I think any time a virus has a chance to go through lots of people, it can do that. But I anticipate schools being open in the fall unless something crazy happens. I anticipate it, which is very good, and maybe we'll still have Wyoming football even.
Hopefully. And so when it comes to the individual Natrona County resident, or me or Glenn or the lady Alex, what do we need to know about procedures we should follow, when to get screened, and when to potentially seek treatment?
Well, we're going to leave the respiratory clinic, which is an outpatient screening center, and public health open with testing availability all summer and all fall. No plans to change that. Healthcare providers, you can call public health and ask questions. You can call our office. A lot of times the symptoms can be mild, and if you've heard about the weirdest symptom thus far, you lose your sense of taste and smell, and it's dramatic. And if somebody notices that, they need to get tested. It is dramatic. It just leaves you, and that is the biggest hint probably this summer.
You talked about testing capability and expanding that as the year wears on here. In Natrona County, and I guess statewide, really, is our testing capability sufficient to give us an accurate picture of just how widely the virus has spread here?
No, not through anybody's fault. It's just, it's hard to make a test quickly when you have a completely new virus. There are two tests. One is the one that tells you you're sick right now and you have it. The other test that we need is, have you ever had it? And that's that serology test. That's not ready yet. And when that becomes ready nationally, then we'll be able to tell how many people in the last 6 months have been exposed to this virus. We need that information as well. So we can test you and see if you're sick with it, but we need the other part of the puzzle.
So, to cap this off, would you be so kind as to remind us who are the folks that are most at risk for serious health impacts if they get this virus? And then for the rest of us, what are the simple things we can do to avoid spreading it?
Okay. People over 65, people with diabetes, heart disease, cancer patients, kidney patients, people in nursing homes, long-term care facilities, even, assisted living. Those kind of people are at the highest risk. What can we do? Follow the rules. Just follow the simple things that we put out there. Face coverings when appropriate, socially distance, don't take chances, use hand gel, and that's really it. And respect the fact that you may hurt somebody else's parents if they're, older. So if you follow the rules, we all have a great summer. That's how I look at it.
Okay. Dr. Brunner, thank you for coming on. I appreciate your time.
Thank you, Dr. Dowel.
Dr. Dowel.
Thank you.